Today's podcast is about backpacking and not backpacking in the context of the ongoing COVID-19 pandemic. If the pandemic has resulted in what is shaping up to be a pretty disappointing hiking season in 2020 for you, stick around and we'll commiserate together.
Look for me in the mountains where walking has a way of pulling you to your peace of mind every day.
Hey everybody, welcome to the Backpacking Light podcast. I'm Ryan Jordan.
And I'm Andrew Marshall, and will be your host today as we talk about what everybody is talking about right now, the COVID-19 disease pandemic caused by the coronavirus. Ryan and I will be joined by two guests. The first is Jeff Garmire, FKT holder, elite long-distance athlete, and friend of the podcast. Jeff, thank you very much for coming back.
Yeah, thanks for having me again.
Our second guest is Maggie Slepian. Maggie is a thru-hiker, a freelance writer, and the managing editor of The Trek. Maggie, thank you for joining us.
Thanks for having me.
Let's start off by kind of throwing some context out there and discussing where we're at with the pandemic. So as of today, the day we're recording this podcast, March 26, 2020, this podcast will probably be out on our feed around the 27th or 28th. The global outbreak of the coronavirus is a little more than 3 months old. There have been 530,000 cases worldwide that have resulted in 24,000 deaths. And here in the US, today we became the most infected country in the world with 85,000 cases and 1,300 deaths. Most US states have just started the very beginning of their exponential growth in infections, with particularly devastating epicenters in New York, Washington, California, and New Jersey. As of this evening, 15 states have now reported more than 1,000 cases of infections each. So it's in this context that the hiking community is facing the hard reality that the next several months are going to look very different as we consider what are going to be some really significant changes that are going to be required of us as we work to contain the epidemic and mitigate the spread of infection within our communities.
So I want to start off by maybe going around and asking what sorts of plans did everyone have lined up for the 2020 hiking season, and maybe kind of share a little bit about what the process was of deciding to cancel or change those plans and why it was difficult. So Jeff, let's start with you.
Yeah, I was actually supposed to be in Tennessee right now to be preparing to run the Barkley marathons that would have taken place this coming Saturday. And of course, those were canceled. The event was canceled. And then I also planned to attempt to set a new speed record, or called FKT, on the Appalachian Trail and the Pacific Crest Trail. And doing both those in the same year is pretty impossible at the moment, and maybe getting one in seems unrealistic, but just trying to say I'm postponing it rather than completely canceled.
And what was the process that you went through of deciding to change and cancel those plans?
Well, first was I've been working with some people for getting out to Tennessee to run the Barkley marathons, and one of them flat out asked if I would still go if the race was still held, because it would be quite a bit of travel, and it was getting to the point where that seemed quite socially irresponsible. And that's when I decided that I wouldn't go, and in the end the race was canceled. And then from there, it was looking as a whole at everything and kind of determining all these places. I've actually done the Pacific Crest Trail 3 times, and knowing all the small communities on that trail, and really most trail angels are older and have been helping people for decades, and it's really putting them at risk if you take something to the trail, or if you spread it between communities that would have a pretty good chance of quarantining themselves against any outbreak as well. And so that's the decision I came to, and then I decided to write a post about it to illustrate that it's not really the fact that you're living in the woods and away from people. It's much more about the fact the towns you are entering are a lot more fragile than one of the bigger cities in America. So it's just heightens the risk, and it seems like going on a hike, something like that, when you're elevating the risk, it could be pretty easily avoided by just postponing it and really treating those communities with respect, as they've helped so many thru hikers over the years.
And Maggie, you had plans for this summer too that involved a long trail, right?
Yeah, I wasn't planning to go as fast as Jeff, but I was planning to do a pretty standard thru hike on the Pacific Crest Trail. I had a permit and a start date of April 29th, and that is obviously not happening.
And we've talked a little bit about what your process was. Was it similar to Jeff's and kind of watching this all accelerate, and then you had to kind of come to a moment where you had to pull the plug on it?
Yeah, it was a pretty similar scenario. At first, I was mostly concerned with logistics, resupply, potentially even getting to the trailhead. And then the more I thought about it and the more I saw restrictions and recommendations to limit unnecessary travel, I started to think, what's more unnecessary than taking 6 months to hike between these isolated communities up the entire coast I was going to go northbound with pretty much the big bubble on the PCT. And so I thought, this just doesn't seem fair or morally responsible anymore. And I think I kind of came to that conclusion before the trail organizations came out with statements. I also published a post questioning the morality of continuing with a thru hike in the middle of a pandemic. And that was in the morning a week and a half ago. And I thought about it all day. And then by the end of the day, I had published another post and talked to my boss and pulled the plug on the hike.
So you guys are probably much more connected to the long distance hiking community over at the Trek than we are at Backpacking Light. But are there still people starting their thru hikes, and what's the community response been to that?
The community response at first, I think it kind of moved in a slow wave where a few people said they were going to cancel. And then the question arose, is it right to do it? Is it even logistically possible? And then, like everything moved so fast, within a few days, the trail organizations had all put out statements with varying levels of concern, and the PCTA and ATC and CDTC eventually, within a few days of each other, all did request thru hikers to stop hiking. And so at the Trek, we decided that we weren't going to be publishing any hikers posts who had decided to stay on trail, and we were going to stand alongside the trail organizations and encourage hikers to get off the trail. And I think that there are some hikers still out there. I know a lot of our northbound AT hikers were several hundred miles in. PCT hikers had just started heading north. But I do believe that the people who have decided to continue their hikes are few and far between. And I have seen kind of chatter on the online groups. There's been kind of a social media and just social general backlash against people continuing their hikes, which I don't think this is the time to divide the community. But I have seen kind of, some talk against people continuing their hikes.
There's certainly been a lot of public shaming in other non-hiking communities about people's extent to which they're practicing social distancing or stay-at-home orders. So I can only imagine there will be the same kind of dynamic going on in the thru hiking community as well.
Maggie, you mentioned that bubble, and I want to talk about that a little bit because I think that there's a little bit of counterintuitive thinking going on here, because I think some people might have the idea that there might be no better place to practice social distancing than to be out in the woods on a thru hike. So, and Jeff, you can jump in, and Ryan too. Why is it that social distancing and preventing this spread is essentially impossible on a thru hike?
Well, I think if anyone thinks that thru hiking in the northbound bubble on the AT or the PCT is social distancing, they've never actually seen a northbound bubble on one of those trails. If you just consider the spread of norovirus pretty much every day, every year on the AT, you know how easy it is to spread a virus. People, the PCTA limits hikers starting northbound to 50 per day, and I was in a 10,000 person queue trying to get a permit for my northbound hike this year. It's packed. The AT, I did it 5 years ago, and there were 55, 60 people at the first campsite I stopped at. I mean, people drop out, within a few hundred miles, and the crowd thins, but there's a surge at the start. You're all staying in the same shelters, the same tent sites, the same hostels. You're moving in a pack, especially at the beginning of the season, because it is a seasonal migration, pretty much is what it feels like.
And what is it like in the trail towns? Because I mean, it's not just one person popping into a trail town at a time. There's probably dozens of hikers at these little places, right?
Yeah, we're all moving at about the same pace. You're all hitting these areas within a few days of each other, and you're moving in groups. And people refer to their cluster of hikers as their tramilies. And you're all kind of moving together, and you go in and out in a cluster, and you fill up hostels and surge into the grocery stores, and everyone goes to the post office. Everybody also in these small towns has the same errands to run. They're all going to the laundromat. They're all staying in the same places. And so it's not just a trickle in and out, especially in the first few trail towns you come to. It's a surge.
So even just setting aside the morality and the ethics of this, the logistics just get so complicated. I mean, even just from a standpoint of people are going to be less likely to stop and pick you up if you're hitchhiking.
Yeah, I think that was a big problem if I was just going to be doing it in a vacuum without the virus. If things were shut down as they currently are, if I was going to try to set a speed record or FKT on the Pacific Crest Trail there, this national parks would be closed down, and that would turn into almost a 300-mile carry while trying to log 45 miles a day. So I was wondering about that and if it would actually be possible long before thinking about the trail communities. And one more thing I'd like to add in on that front is if we just say 1,000 people are traveling or going to start their hike, and one of those 1,000 people at this point is likely to have been exposed or spread the virus, and then if a few of those get it, then they'll bring it to the first town, and then if 1,000 people will pass through that, and one will likely bring it to the next town, and the entire Pacific Crest Trail, every trailside community would become infected just by this, I guess, like line of soldiers basically carrying the virus on and infecting these towns that some of them, have less than 1,000 people, no healthcare and anything like that. So I think that was the biggest problem I saw, is it's not an isolated trail that you're only on the trail. It's so many interactions with people that take it back to their own community.
All the more impactful for asymptomatic carriers as well. This is still kind of one of those areas that we don't have a good feel for, but we know that a substantial fraction of those infected are asymptomatic. And to me, that's just a huge risk.
Yeah, I completely agree. And I think that's the scary part about this whole thing is it takes so long to present itself, and sometimes it really never does, and you're not aware.
So the situation is changing quickly, especially when it comes to the national, state, county, even down to city and local governments ordering different versions of different types of quarantines and stay-at-home orders. How do things stand in each of our respective areas? Jeff, you're in, where are you right now?
I'm up in Montana as well.
Okay, and Maggie's in Montana as well. So what's the situation there?
There's going to be a some sort of stay-at-home order that goes into effect this weekend, actually.
And do you have a good sense of if that includes outdoor activities or not?
There's a special provision for outdoor activities where social distancing is taken seriously, I guess. So you can go on a jog, which I was, I guess, selfishly happy to read.
Yeah, it seems like that provision or that special exception is, I'm seeing that in a lot of these orders, which I think brings us to our next section, the next thing I want to talk about here, which is how can we enjoy the outdoors responsibly and ethically in 2020 and beyond? And is there a way to backpack ethically in this situation? So I'll just open it up to anyone who wants to jump in here.
Well, just to give my opinion, we'll start with that. I think that ethically, with no idea how long this will last, if you drive to a trailhead or an open trailhead or a piece of public land where it's legal to backpack currently, and you go on a 3 to 4 day backpack and end up back at your car and then drive back to the community you came from, I feel like that doesn't violate any ethics or increase risk or anything, and it may decrease and make you healthier and happier as well. So that would be kind of where I would say staying local and, not being the connector, that piece between communities, I think is really what we're trying to do.
Yeah, interestingly, we spend a lot of time down in northern Colorado. I live in Laramie, so it's an hour drive to Fort Collins and less than 2 hours to Estes Park and Rocky Mountain National Park. And we were definitely looking forward to the spring season down in that area because we love hiking and snowshoeing up there. And when Larimer County, which is the county where Estes and Fort Collins are located, issued a stay-at-home order a few days ago, uh, we were feeling like it was already late in coming because you got Rocky Mountain National Park here. It's close to Denver. It gets an enormous amount of visitation, and finally Estes Park made this plea to the Park Service and said, please shut down Rocky. We've got our first COVID case in our community, and we can't have this influx of visitation from the Front Range and beyond. I mean, it's a worldwide destination. And so finally, the Park Service did shut down Rocky Mountain. The state of Colorado did issue a stay-at-home order. And for us, it was like, okay, we're going to stay close to home. And even our day hiking routines have been adjusted because we're not traveling as far. We're not leaving our community. We're trying to stay as far away from busy trailheads as possible. And my concern is that as these national parks shut down, and as these there's even communities that have shut down their local community and state parks, then what's going to happen? Are we going to concentrate more people at the fewer trailheads that are open? And as more people get kind of shut indoors, are there going to be more people visiting those trailheads that aren't normally going to be? So it'll be interesting to see how this evolves over the next several weeks.
We've actually already seen that in the town I'm in. This is kind of the height of shoulder season here, and people have been cooped up all winter, and there's very few trails at the lower elevations here that are open. And so, people do their best. Stores are closed, and people do their best to maintain social distancing in town. But we had a nice day a few days ago. It was sunny and low 40s. And I had a friend who went to try to go on a run at a trailhead, one of the only ones that's accessible right now. And she said it was just end to end packed with cars because everybody had the same idea. And so I'm not sure in the county that I'm in if they are going to put out more explicit statements with limiting backcountry recreation, just because we're already so concentrated at this point in the shoulder season with what is available. So I guess we'll find out soon.
And I know where I am in California, a lot of the gateway communities are just begging people even not to drive in from 30, 45 minutes away. They just don't want people, even coming in from that far away, possibly getting sick. And as Jeff's pointed out a few times, overloading the resources of these small mountain towns. So your friend Maggie, did she park and go on her run, or did she turn around and leave? And what is the ethical thing to do?
She left actually, and she kind of sat there for a while in her car, and then decided that it wasn't the right thing to do. And I think before these become not policy, but before these become recommendations or regulations, it is a hard choice to make. When I decided to cancel my PCT hike, the statements hadn't been put out yet. And so you always wonder whether it's, your last chance to go on a trail run or your chance to do a 2,000-mile hike. Am I making the right choice? No one's actually explicitly said not to do this. And so I think that there's always that period of time when something feels like the morally correct thing to do, but before it's been explicitly stated, that you have to kind of decide for yourself and understand how fast things are changing, and that maybe what you want to do and this recreation that you want to take isn't necessary and could be putting other people at risk. So she came home.
Yeah, I think Jeff could speak to that. Jeff, you put in a ton of training and effort over the last, I mean, I've been following you getting ready for the marathons for a couple of months now, and you're just putting in brutal runs. And I know that from our conversation a few days ago that you really agonized over trying to weigh the effort you had put in versus bailing on this thing.
Yeah, it was pretty tough, especially, with one goal, or kind of have 2020 mapped out for, if between the Barkley marathons and trying to set a couple records, it was almost mapped out down to the day or even hour some places, and then have that all kind of disappear. And it was the snowball effect. At first, the Barkley marathons kind of was not going to be a thing, and then looking further, just cross more things off the list, and then start staring into the black hole of 2020 instead of the most regimented and planned out year I thought I could ever have even come up with. So it was definitely hard.
I'm wondering, as people try to find areas that are less and less crowded, and maybe as national parks close, maybe BLM land stays open, I can see that happening. What sort of risks do we run into as people maybe start venturing out into more remote places than they normally would?
I think the first thing, and might be a no-brainer, but is getting hurt, or if you're allergic to something or having some need for medical attention, is just very irresponsible. So I think there's nothing wrong with hiking or even jogging, like maybe a dirt road or something in BLM land, but like highball or bouldering or anything like that, or unnecessary risks, I think is just asking for trouble in a time when I think we're all trying to limit our risk by standing 6 feet apart. So I think being mindful and some common sense on that front is the first thing I'd like to throw out there.
That's also my concern with the general population participating more frequently in outdoor activities, especially less experienced people, because this is one of the few things they're going to be able to do, perhaps. And I spent a couple of decades working search and rescue, and invariably most of our incidents were less experienced hikers getting in a little bit over their head, not too far from the car. And you multiply the population of people using the backcountry by a factor of 5 or 10, and all of a sudden the few incidents a week become a real drain on search and rescue organizations and other first responders.
So if we just had to sum up bullet point, how to backpack responsibly right now, what would we say?
Honestly, I would say don't. And I know that probably goes against the industry that I work in, but I think that, yeah, being outdoors is good for your health, and it's good for it's good for your physical health, your emotional health, your mental health. But at the same time, it is a luxury that we're able to do it, and it cannot be defined as a necessity, I don't believe. And so I think for the time being, the more we follow these recommendations and the more careful we are, the faster this whole phase is going to be over. And so just kind of based on the fact that if people do want to go backpacking, they have to go to a really remote place to do it safely and within the guidelines. And the people who are, skilled enough and experienced enough to do that are fewer than they'd probably think. And so I would say stick to local trails while you can, while they're not crowded. Get your exercise in other ways. But I would tell people for now, just stay out of the backpacking loop.
Ryan, Jeff, thoughts?
My perspective is kind of driven by where you live. So if you live in an area where backpacking is a very common activity and you're bound to be competing with other hikers on trails like Colorado or California, or in the Adirondacks, for example, or the Southern AT for that matter, I think the moment you step out onto the trail in an area that's potentially crowded is going to be very risky for community transmission. So in those situations, I would say pull back. Yeah, cancel your trip, plan something else locally. Then there's those of us who live in incredibly rural areas like myself, and very few people even backpack where I live. And so I can walk out into the Wyoming desert a few hundred yards and pitch a tent, and I'm in the backcountry, and the risk is low, and I can stay away from everybody I want to stay away from. So again, I think it's about mitigating risk, but I think the trips that I normally have planned, they're off the table now. And I've got to completely reframe how I look at a backcountry trip in this day and age. The other thing I want to emphasize is that we're in this phase of logarithmic growth, exponential growth of the pandemic, and it's just kind of getting off the ground here in the United States. And so this issue of household to household and community transmission is a really big deal. And so the biggest thing I want to emphasize is don't go backpacking with members who are not in your household, so that an asymptomatic carrier of the infection is not going to transmit it, because backpacking as a group is an inherently intimate activity, and it's kind of difficult to mitigate association with each other, physical association with each other. And I would just say, keep it within your household or family group.
Yeah, and I think I guess I would say that this, however long it's, kind of stay at home and don't interact and everything, it's not to be treated as like a vacation or a chance to go out and try out backpacking for the first time or do something new. Maybe it's a time to learn a skill like knitting in your house, but not to try a skill like going in the backcountry and using a stove for the first time. So I think there's this, big responsibility to look at yourself in the mirror and decide if going out there is, you're over your skis, or if it's something you can handle or something you're comfortable with. And if it is kind of on the fringe, load up your pack and go on a day hike with your whole backpacking kit and start there or something. But I don't think it's a time to be elevating the risk in any way. Like you see people their first day on the AT or the PCT, they're learning how to set up their tent and use their stove. It's not a time to substitute that in because you postponed your hike. It's a time to do what you're comfortable with and try to not add risk to the community you're in or the world in general.
I was thinking about another situation as well, where I read this blog post from someone it was a group of college students that lived together. They decided to, ride this thing out as a household unit. One fellow had to travel about 40 miles to another community to pick up some supplies, came back, and during the time he was gone for a day. And he learned on his way back to his roommate's place where he was sharing a house that one of the roommates had come down with symptoms pretty rapidly. And so the person who was traveling was in this dilemma, is like, okay, do I go back to the house and expose myself to whatever he's got? He didn't know if it was COVID or not. And it became this very intensive dilemma of decision making. And I was thinking about, okay, if I go out on a backpacking trip, and let's say I go out solo or with my son and my wife stays home, and we go out for 3 or 4 days and I come down with symptoms, then what do I do? What's the scenario for coming back into the household or quarantining, or do we quarantine apart, or vice versa? What if my wife was at home and she came down with symptoms while I was out? And these are like really challenging questions to wrestle through, and probably not something I really want to answer while I'm recreating,
Yeah. Yep.
Well, I want to wrap up this portion of the conversation maybe by just giving everyone a chance to, I don't know, give maybe some advice or some thoughts about how to stay sane during this time. We're all outdoor people and we all do this because it meets a really deep-seated need in us. And I know the internet is awash with suggestions of how to use this time. And for some people, it's not extra time, but just wondering if anyone has done any thinking about how you as an outdoor lover are gonna weather the next few months.
Yeah, I think how I'm going to do it is I put away my watch. I'm not using Strava. And when I go for a run or a hike, it's simply because I enjoy it. And when I've gone far enough that I'm not enjoying it, then it's over and I come back and that's it. It's kind of just treating this as where everything pretty much is canceled in the future. So it's not like I have to stick to training plans or mileage or anything. It's really just getting back to when you're 6 years old and love to run, or on your first hike and you fell in love with hiking. It's really just getting the metrics and comparability out of the way and not worrying about that, and just, finding the joy in whether it's walking, running, reading, hiking, anything like that.
How about you, Maggie? Where's your head at right now?
My head is at trying to undo all of my preparation for the PCT is kind of the first on my list. I've actually been fairly busy and distracted with trying to undo the logistical decisions that I've made before leaving. As far as staying active goes, I'm setting aside dedicated time each day to do an online yoga class or to take my bike out if the roads are dry, to go on a short run downtown if it's acceptable. And so I'm also kind of treating it like a pressure's off type of thing. I don't know when I climb also, and I don't know when we'll be able to get back into technical mountain biking or climbing. And so trying to take some pressure off of myself. I can be pretty performance oriented. And so we don't really have an option. And so I'm trying to focus on staying active for a period of time each day and making sure that I have dedicated time to do that without putting any pressure on myself to stay in the kind of conditioning that I would ideally like to be in.
And how about you, Ryan?
Yeah, I mean, it's been an interesting few weeks for sure. We've been kind of locked down ourselves for about a month now. Stephanie had a surgery about 4 weeks ago, and so we were kind of intentionally staying at home for a couple weeks anyways. And then this happened, and so we're kind of easing into the whole idea of, okay, this is going to go on for several months. So what are our new routines going to be, and how are we going to maintain productivity, life satisfaction, and health through those new routines? And so, for us, kind of like Jeff, this is like a training cycle for me, getting ready for summer expeditions, which I'm not expecting to do this year. So being able to, again, put away the watch, like Jeff said, and just go enjoy walking for the sake of walking has been really, really nice. And then from a business standpoint, because we've had to cancel a bunch of our live events this spring, and our guided trekking program this summer is obviously on the chopping block, then we're pivoting more towards online education, which we've been working on anyways for the past couple of years. So we see this as an opportunity to focus and grow that area. So at the same time, we're struggling because this is a grieving process, right? Transitioning into this period of what wasn't planned. And there's definitely some emotional difficulty and grief that goes along with that. And I imagine that's really intense for Maggie and Jeff, who had these huge plans and then have to deal with the disappointment of having to cancel them.
All right. Well, Maggie and Jeff, thank you so much for joining us. Really appreciated all your insight and your expertise here on this issue.
Yeah, thanks for having me. And I think it's good to show that pretty much everyone had to give up a lot, whether it's through hiking or a job or who knows, but it's a difficult time for pretty much everyone in the world.
Yeah, thank you very much, Ryan and Andrew. It was great chatting with you.
Yeah, best wishes to you both. We'll see you on the trail soon.
Thanks.
Thank you.
Bye.
So, Ryan, I wanted to ask you about what happens after the exponential growth phase of this pandemic, because I think this is the next thing we need to be thinking about. Is there anything to consider once the peak has passed, but before widespread vaccination becomes available? And I guess I'm wondering specifically about, are we going to be able to return to group trips that involve members of different households?
Well, if we look at we have a model ahead of us in Wuhan, China, and they probably in about 2 weeks after this podcast lands, they're going to start relaxing their restrictions on stay-at-home orders. But their Department of Health has developed some very specific guidelines about intermingling among households, social distancing, and hygiene. And I think those three things are going to be very important to consider as we move forward in the face of a pandemic where we don't have a vaccine yet. So yeah, absolutely. And we have developed through our guided trekking program a set of guidelines already that is based on minimizing infectious disease transmission. And we came up with these guidelines in the face of epidemics mainly because there's so much literature in outdoor education research that discusses infectious disease transmission on group trips. Much of that came out of the National Outdoor Leadership School. They've learned a lot over the course of the last few decades, and rightly so. They've probably hosted more participants on guided treks than any other organization in the United States. So we look to them. We look at some of these countries that have kind of strict social distancing guidelines in the face of epidemics. They've had much more experience with this in Asia than we have had over here. And so, yeah, some of these things include, here's what I would expect after the peak and after the curve starts to drop a bit. Some simple things like travel in your own personal automobile to your destination instead of renting a car, flying, or taking public transit. And more importantly, if you're going with multiple households in your group, have everybody travel in their own cars to the trailhead, for example. Don't share pre-trip accommodations with persons from different households. For example, if you're staying in a big cabin tent at the trailhead, or you're staying in a hotel together, get separate accommodations. Again, in the absence of a vaccine, there has to be some level of assumption that there may be asymptomatic carriers in one or the other groups that you're traveling with. Mm-hmm. Another obvious one is to make sure each household has their own shelter systems and cooking gear, and that people aren't swapping gear with each other. So I don't see it to be practical to take a can of Clorox wipes with you on the trek, and then say to your friend in your other household group, hey, can I see your alcohol stove? And he says, yeah, sure, let me wipe it down with a wipe, and then hand it to you so you can examine it. So simple stuff like that, where you're not sharing equipment and supplies and food, things like that. So those are a couple right away. Some of the other more nuanced ones would be make sure everyone in a household group has their own communications device, like an inReach or a sat phone, so that they can be communicating with their family back home. This is going to be a tenuous time. We're going to see waves of infection come and go throughout the next probably 18 months. So being able to stay in touch with your family back home, I think, is pretty important too.
And then seems to me that it goes without saying that you're still maintaining social distancing out in the backcountry, right?
Yeah, I think so. Again, it's being respectful of other people's space, which we try to practice anyways. But we might have to be more intentional with it in the face of a pandemic. And so, obviously maintaining social distancing guidelines. What are they now? 6 feet. Some communities have said 3 feet in the early part of the pandemic. So whether it will relax to that, I just don't know. But camping farther apart than usual in household groups might be necessary, because a lot of activity is concentrated around a tent. And then I think also, one thing we have always taken for granted is that whenever we do a group trip, someone invariably shows up sick with a cold or something, because sometimes it's exhausting preparing for a backpacking trip and you get no sleep and you're trying to tie up loose ends at your job, and you're packing supplies at the last minute at 2 a.m. and all this kind of stuff. And then you travel and you get exhausted and you come on the trip with a cold. Now, I think if you are showing symptoms, you don't go. You have enough respect for your group that you just say, you know what, I got sick. I don't want to infect you. I'm going to pull out this time. And ultimately, those are decisions that have to be made by the person who's being sick. But at the same time, I don't think it's unreasonable to have a boundary that says to a sick person, hey, I'm not comfortable with you coming on this trip.
Yeah, and I think that's a muscle that just needs practice and needs flexing.
You bet.
That is not an intuitive thing for us to do. The more effort we put into something, the less likely we are to want to just give up on it.
Right.
But I think we're all going to get a lot of practice at that over the next couple of months.
Yeah, for sure. I know one kind of guideline we've always had in group trips is that if you are sick with a potentially infectious illness, please don't use man-made backcountry facilities like latrines and cabins. So that, because those are enclosed areas, and so respiratory droplets can be concentrated in those areas, and then, have someone who's well using it right after you or something is just not, that's a great way to spread infection. So that's always kind of another one that we emphasize, and I think we'll be emphasizing that more as we move forward.
All right, well, let's wrap up by talking about some resources that we have that could help people navigate the next couple of months.
You bet. We've got a couple of forum threads that have several hundred posts in them from our community members. They are discussing COVID-19. There's daily updates. They talk about backpacking in the context of COVID-19. And there's a forum that even promotes help between community members. So if you need some help through this crisis, throw it out there, and you're likely going to get a response from one of our community members. I know we had one person say that they were out of hand sanitizer, and we had a community member jump in and ship them a bottle. So, things like little things like that. But at the same time, you can see that it's been therapeutic for people to participate in online community in the face of, social isolation, which has been difficult for some people, and kind of a big change for all of us. So the chance to participate in that community and maintain that connection to fellow backpackers, I think, is really important. We have one of our partners, Ripstop by the Roll, has come out with a DIY mask kit. So if you are bored at home and know how to sew or want to learn how to sew, they are offering some mask kits that you can purchase, make a mask. You can make one for yourself or give it to a healthcare facility. I know my healthcare facility here in Laramie is not in need of those masks right now, but they are certainly not turning them down. And so there's always an opportunity to make a healthcare worker a mask and provide some support to them that way.
And what about some online education resources that Backpacking Light has right now?
Yeah, so, pretty much in the first 4 months of 2020, we've wiped the slate clean of all our live events and film festivals and things like that. And so we'll be coming out with our online film festival very soon. We'll be making a decision on the status of our guided trekking program in 2020. And of course, clinics and other live events are off the table for now. So our focus, we're going to refocus our energies into online education. That includes webinars and master classes and online courses. We just launched a new trek planning online education program, and we're going to be putting our energy into that for the time being so that people can still maintain their skills and connect to backpacking in a meaningful way through online education. So yeah, if anybody's interested in anything like that, you can go to backpackinglight.com/education and you'll kind of get a feel for what we're offering this year.
As we wrap up, I'd just like to offer my final thought, which is that I think I land somewhere between Jeff and Maggie on this in terms of how okay a backpacking trip is. We can go on and on about the specific instances of each thing, but ultimately what I would like to say is just to err on the side of caution. And if it feels even the slightest bit like you might be putting someone else at risk of contact or infection, just don't do it. That's kind of where I land. What are your final thoughts about all this, Ryan?
I totally agree with you. And I really gravitated towards that idea when I started hearing people in trail communities and communities like Estes Park, gateway communities to national parks, who were begging people not to come visit them. And it's like, how can you disrespect that? These people they're scared. They're in small towns that have very minimal hospital facilities. A lot of the population is comprised of elderly people, and it's really hard to make the decision to put them at risk.
All right, everybody. Well, stay safe, stay healthy, stay sane out there. That's going to do it for this episode of the Backpacking Light podcast.
The Backpacking Light podcast is supported by backpackinglight.com membership fees.
A backpackinglight.com membership gives you access to nearly 20 years of article archives, community forums, online education, and so much more. You can join our community right now at backpackinglight.com/subscribe. You can download the show notes for this episode at backpackinglight.com/podcast.
And if you enjoyed this episode, please leave us a review. It helps other people find the show and helps us deliver valuable information to them like this.
Thanks for listening to the Backpacking Light podcast. I'm Andrew Marshall.
And I'm Ryan Jordan. And if we can leave you with one parting message, it's this: pack less, be more, because lighter is better and healthy is best. Happy trails, everybody.
So I shoulder my backpack, walk away from the